Hi, I'm Lawrence Bergstrom, registered osteopath at Swale Back Pain Clinic and a non-surgical advanced trained spinal disc specialist. Now, why would you come and consult with us? One of the first reasons is we've been right where you are now. We have all suffered severe spinal pain and injury ourselves. That makes us relatively unique in that we understand exactly what you're going through. The inability to get on with your daily life, the inability to dress, the inability to put your shoes and socks on, to turn in bed, to get in and out of a car, the emotional impact of having chronic daily pain, that you've been to see other people, you haven't had any answers, you've tried different exercises, you've tried different medications, you've maybe had injections, perhaps you're facing surgery, and it's a worrying time. Also, the impact upon your family and your friends, your work environment, perhaps you're not able to go to work at present. We've all been there and we've experienced it, and thankfully we've passed through that journey and we've come out the other side. So you can be assured, if you choose to consult with us, you will receive an empathic and understanding approach to your pain. You won't be faced with silly questions. We know exactly how you feel, and as I say, we've been there ourselves, so you will receive the utmost empathy in your journey that you're experiencing at present. Another key area is expertise. Now, personally, we don't believe there's any such thing as an expert because we're all learning, or should be. We never stop learning. That being said, I have over 25 years of experience as an osteopath managing spinal pain alone, and over a decade of that was spent working within a multidisciplinary team within our NHS. So both in private practice and in the NHS, I've amassed a huge amount of experience, which continues to grow. We invest heavily in our knowledge, so that is to say our continuing professional development, so whether that's training courses, research, and that's international. So we liaise with other clinics, independent clinics, internationally and nationally. So that's great for you because it means you haven't got one person and their opinion. If need be, we can reach out to a vast network of highly experienced clinicians, which helps put you in the driving seat of your decision making, and it ensures best practice for us taking care of you. We've also invested very heavily in the latest evidence-based, proven state-of-the-art equipment. So this helps us to help you on your journey to recovery. Nothing stands still for long in medicine, and as further developments increase and are underpinned with evidence and research, we're able to provide you with this care, which leads us on to another key point. We track all our data within the clinic. So at any given point, we are following your journey from initial consultation, diagnosis to recovery. So you can be assured that it isn't a cookie cutter approach. You're treated as an individual with an individual problem, and we manage that accordingly, but we track your progress throughout, okay? And within that, we're then able to discuss the proven results and the testimonials of the many patients that we treat and the significant number of success stories. So data-driven practice. We are also practicing the latest evidence-based medicine when it comes to spinal pain. So a multimodal approach. So whether it's non-surgical spinal decompression, whether it's manual therapy, exercise rehabilitation, acupuncture, exercise, lifestyle advice, and psychological support, we are very, very, very passionate about adhering to best practice. So you get gold standard care when you come to see us, okay? Another key thing, diagnosis. Diagnosis is key. Without a diagnosis, we'd be wasting your time. So we have to arrive at a diagnosis, which we're stringent about. Once we have a diagnosis, that then leads us to a prognosis, which essentially is how we would expect your outcome to be, and the journey to arriving at that. Okay, so that's another key element. Also, we want to make ourselves redundant to you. That's a very important feature of our care as well, because by the time people come to see us and consult with us, we're quite often the end of the line for most people. They've seen a broad range of physical therapists, they've tried different forms of exercise, they've tried medication, they've maybe had injections, maybe they've even had some form of surgery, and they've seen consultants and they're still not getting the answers that they seek. So we are passionate about arriving at a key diagnosis. Once we have that diagnosis, then we can set in train a management plan for you, which is tailored and personalised for you to get you out of the clinic and back into your active life. And that leads us on to another key element of our care. By making ourselves redundant to you, we and you are aligned with the same goal. If you choose to consult with us and we believe that we're a good fit for the problem that you have, our aligned goal, that is to say your goal and our goal, is ultimately to reach a point where you leave the clinic with the last clinic you step foot into with the problem that you have, and then we can set you on your way to getting on with your active life and you don't need us. Okay, so that's another key element. So hopefully this video goes some way to explain how our process of care is aligned with a key diagnosis, a tailored program of care for you, and ultimately making ourselves redundant to you. If you'd like to learn any more about our care plans and how we can help you with your chronic spinal pain or nerve pain, your disc injury, then please contact us at Swale Back Pain Clinic and we'd be delighted to help you. Thank you.